Okay guys, today we're going to talk about a ubiquitous herpes virus that's persistent for a lifetime. 90% of the population of the world has it, and it spreads by human contact. Hence, it's called the kissing disease, with no known environmental reservoir. This is Dr. Tim with Optimized Wellness Center, and thank you for checking in with this video today. If this information is helpful and valuable to you, press the like button and make sure to subscribe to our channel so you can catch up with our next videos every Friday. As well, if you know anyone who may benefit from this, make sure to share it with them and post your comments down below. All right, guys, let's dive in. Yep, you got it. We're talking about Epstein-Barr virus, or EBV. Other names that may be included are human herpes virus 4, or glandular fever, or mononucleosis, or sometimes otherwise known as mono. Now, herpes viruses are a family of mainly DNA viruses, and they include such viral celebrities as viruses that cause the chickenpox and shingles, and those that cause other forms of herpes, as well as Epstein-Barr virus. Now, EBV has both DNA and RNA which replicate in the oral epithelial tissue, meaning like the inside of your mouth, and are released into the saliva and end up infecting B lymphocytes. Interestingly, the link between EBV and cancer was what led researchers to discovering the virus in the first place, and it was published in their findings in The Lancet in 1964. Let's talk about some of the important characteristics. Now, it tends to incubate for somewhere on the order of 4 to 8 weeks, essentially laying dormant inside of cells, and it stays in this latent stage or cycle for a very long time, evading detection by our immune system and spreading through our lymphatic system. The virus can persist in the mouth and be spread to others for 32 weeks or even as much as 18 months after recovery. EBV remains subclinical in around 90% of children. Now, mono is an acute symptomatic stage with adolescence, and it peaks somewhere between 15 and 24 years of age. Now, mono is uncommon in adults because they have antibodies. And if an adult gets it, they are more likely to be hospitalized. Some of the most common symptoms include fatigue, fevers, chills, pharyngitis in our ability to be able to have a sore throat or swollen lymph nodes, headaches, as well as body aches. And this plays a critical role in certain kinds of cancers, MS, blood disorders, and even long COVID can be reawakening of EBV. Additionally, there's something called molecular mimicry which can occur, and these cells will bind to self-antigens, and it can be related to things like thyroid conditions like Graves' disease, kidney diseases, and then also in your gut with Crohn's disease, lupus, SLE, RA, Sjogren's, amongst others. Now, I'm going to put some links down below for some of the research on this also. Studies have shown that 82% of COVID patients have reactive EBV. EBV can enhance the expression of what's called as ACE2 receptors, and it will be worse when you have low vitamin A status. Additionally, there are some links to what's called as NF-kappa B, which is driven by inflammation and then subsequently drives autoimmunity. And so NF-kappa B can be inhibited by certain compounds, and we're going to talk about some of those in a moment. Make sure to recognize that most health conditions, including EBV, are driven by stress. Now, there are ways to reduce stress, and we've talked about these in some of our other videos. For example, getting outdoors for an hour or two a day, writing in your journal, getting proper sleep, and then utilizing diaphragmatic breathing. Make sure to check out our videos on those things as well. Importantly, the vagus nerve is very powerful as an anti-inflammatory, so make sure to look at that video in addition. So let's talk about testing for a moment here. This can be really tricky because the virus tends to morph. One important test is monospot. And this can be helpful only in the first 3 weeks of the illness. After about 2 weeks of exposure, what's called as immunoglobulin M viral capsid antigens will be positive. And then this VCA, or viral capsid antigen immunoglobulin G antibodies, develop later and persist throughout life. Now, immunoglobulin G for Epstein-Barr nuclear antigen testing is also useful after about 6 to 12 weeks from the initial symptoms and will also persist indefinitely. So of course everyone wants to understand what are some useful things that we can do as it relates to treatment. I'm going to go through a long list of things that can be helpful. I would suggest working with your provider who is skilled and knowledgeable about this and can help you to put together the specific and appropriate regimen for you. For antivirals, there are a variety of products that can help to reduce this. Let's talk about something called glutathione. It helps with antigen presenting cells, and NAC is also something that can reduce inflammation and dampen EBV. Magnesium can help reduce CD8 T cells and deals with chronic EBV. Now, we can also talk about something called black cumin, and this helps reduce EBV cell growth and is also a powerful anti-inflammatory. Quercetin can help reduce IL-6 and ROS as well as inflammation and promotes autophagy. Resveratrol will help to inhibit the lytic reactive cycle, which is happening in the early stages. Something called cordyceps can help to suppress the replication of EBV and is also considered an adaptogen. Curcumin will inhibit the proliferation of EBV and is also anti-inflammatory. Consider berberine because it inhibits proliferation of EBV and promotes Th1 responses as well as anti-inflammatory activities, and will help also with insulin resistance in type 2 diabetes, which could have a co-infection. Something called EGCG, which is found in green tea and matcha, will block the lytic cycle and modulate your Th1 and Th2. Ginger will promote Th1 responses as well as inhibit EBV. And so you can drink a ginger tea, and this is especially helpful with or between meals. Consider probiotics because they can help with the Th1 response as well. Selenium is another thing to consider because it has antiviral effects and will reduce the replication. It would also be important to consider checking your B12 status. If deficient, this will suppress your CD8 T cells activity and it will dampen your ability to be able to fight off EBV. Astragalus can be safely used in all autoimmune conditions as well as Epstein-Barr virus and is helpful in this instance. You can see there's a long list of various things that you could be doing to help with EBV. I hope this was, informative and provided you some good insight, folks. Make sure to press that like button and share this with others, and I'll look forward to catching up with you in the next video. Take care.